Thank you all for being here. My name is Patrice Toney. I'm an assistant city manager for the city of Winston-Salem. As you all have probably heard, the city of Winston-Salem has been looking into alternative response models. These would be alternatives to police responding to mental health related calls, whereas person in a mental health crisis or with a mental illness may not need law enforcement response, but rather some kind of support services that can keep them from being incarcerated and help with further treatment. And so this is something we've looked at as a city for a while. It is a priority of council, our public safety chair, James Taylor, and we really want to move forward with this. However, we could not create a model without input from the community. This was important, this is a priority, and we do want to hear your voices today on what you all would like to see from the city of Winston-Salem in terms of some type of alternative approach to law enforcement response to certain types of calls. And so we welcome your feedback, input, your level of knowledge. I know there's some mental health professionals here in the audience today, and so we want this to be a conversation. This should not feel like a formal public hearing. I'm not going to set a very specific time for your comments, but I hope that you all can be respectful and make sure that your comments are limited to give other people opportunity to weigh in on this very important issue. I think it will be very important for us to have some type of model. It'll help the community. It'll help reduce incarceration rates. And I think in an era where we have reduced law enforcement, there are other type of people who can be responsive or even in a co-response situation that can provide support services that are experts in de-escalation responses and can do the follow-up work that people really need, support services that are critical to people's mental health and well-being. So I today invited some experts kind of in this space, and I didn't have to look far. I called over to Winston-Salem State University and reached out to the Justice Studies Department, and there resides Dr. Jack Monell. And I'll read a little bit about his bio because I think this is so important to understanding why these two people are so important to help engage this conversation. Dr. Jack Monell is the Faculty Senate Chair and Associate Professor for Justice Services at Winston-Salem State University, with over 28 years of working in the field of social work, criminal justice, and human services. A scholarly practitioner with a broad range of experiences, he has worked for nonprofit, local, state, and federal government agencies. He has published extensively exploring Black masculinity, violent police, citizen encounters, and popular culture's misrepresentation of the Black community in music, film, and print media. Dr. Monell received his PhD from Walden University, his Master of Social Work from Howard University, a bachelor's from Towson State University, and a postgraduate certificate in sociology. What a remarkable background. The second facilitator will be Dr. Denise Nation. Dr. Nation is the chair and associate professor in the Department of History, Politics, and Social Justice. Dr. Nation has been at Winston-Salem State since 2007, serving in various capacities on departmental and university-wide initiatives. Her commitment to scholarly activism has been widely recognized not only at Winston-Salem State, but in the Winston-Salem community, state of North Carolina, and the country. Dr. Nation was instrumental in creating the Ronnie Long Project, which is an African-American male who was wrongly convicted of a crime in 1976. In doing so, faculty and students within the Department of History, Politics, and Social Justice integrated scholarly activism within the curriculum to amplify the injustice of this wrongfully convicted African-American male from Concord, North Carolina. In August of 2020, after serving over 44 years, Mr. Long was finally freed and eventually exonerated by the state of North Carolina. So most recently, Dr. Nation, it's important to mention that she has been working with residents in our Happy Hill neighborhood that we're all familiar with. Dr. Nation earned her doctorate from the University of Connecticut, her master's degrees from Old Dominion University, and her undergraduate degree from the University of Maryland, College Park. Let's give our facilitators a round of applause. And as they come up, I do want to acknowledge a council person is here. This is Councilmember Larson. Do you want to wave your hand or? Okay, I just want to acknowledge our council member here. Councilmember James Taylor, who's chair of the Public Safety, unfortunately could not be here, but he is going to listen to these comments. We will create a report, and so we will report back on some of the ideas and suggestions that come out of this group. Okay?
Good evening, everyone. Good evening, everyone. Good evening. So I'm Jack Momel. Jack is fine. And I have the privilege of being here. And Dr. Nation and I, we're going to engage you. So the objective of this meeting, as Ms. Tony stated, this is not what I guess you would identify as kind of like a traditional kind of meeting per se, where the council's meeting and you guys are raising concerns. This is an attempt for us to hear your voice in a manner that's constructive, hopefully productive, so we can bring that back to the powers that be to implement some innovative approaches to addressing a very sometimes overlooked population in our society, right? You know, mental health is not unique to Winston-Salem. It's not even unique to North Carolina. If you look at the country, if you look at the media, mental health concerns is broad, extensive. Oh, I'm sorry. Oh, I'm sorry. Okay, I was pretty loud. Okay, I gotta do the mic. I'm sorry, y'all. So we, it was very important when Ms. Tony reached out to our department, Dr. Nation and I, you know, even though we tend to be rather busy with other obligations, we saw this very important to engage Dr. Nation, and she'll speak immediately after me, obviously. She's working with the Happy Hills community, but that's just one of many kind of community involvements that she's engaged in since she and I both kind of came to the area with transplants, obviously. But we're excited to be here this evening. I hope that we can have a constructive conversation about maybe what your concerns are, maybe what your ideas are. You know, I know we're supposed to be like the professionals, I guess, and for intents and purposes, you know, we know a little bit about a lot of things, I guess, but that's not why we're here. We're here to gauge your pulse and hopefully provide some constructive feedback to our leadership, our city leadership. I do have a background in mental health and counseling early on my social work side, so I kind of understand some of the nuances that happens and what people endure as far as trauma goes. Some of my recent work has delved into how police engage with community members, particularly African-American males. So it is our hope that whatever we implement here in the city will benefit all of us, because the reality of it is it impacts us all. So I thank all of you for the opportunity to be here. In typical fashion, as a professor, we can talk and talk and talk. So I'm gonna be quiet, and I will pass the mic to my esteemed colleague and department chair, and she'll give you a few comments and kind of frame how the discussion will go, and then we'll kind of pass the mic, as they say, and we will engage, and I think Ms. Tony will kind of flag us as we're winding down. So thank you. I hope to have a very robust discussion this evening. Some of you are familiar from our community work, and I look forward to it. Dr. Nation.
Okay. Hi, good evening, everyone. So I'm Denise Nation, and working with the community has been instrumental in everything I have done, you know, in my career. I remember when I was looking around after finishing my PhD at University of Cincinnati and looking for jobs, the first thing they were telling me, like, there are certain schools you should not go because, you won't be able to, do all these research on publishing, so on and so forth. But my vision was bigger than that. My vision was bigger than myself, and I have continued that vision. How can I serve the community? How can I serve my people, right? If you look at the extensiveness of inequality within not just the American society, but across the universe, this is a consistent thing. And so the fact is, people who have little power, people who have very low voices, people who are in higher places and positions must be the advocate for these people. And so I'm a scholar, but I'm an activist, and I'm also an advocate. And this is why this project is so important to me. And when Ms. Tony called us, I'm like, yeah, definitely. As much as we can engage and interact with the community, because the entire thing here is that I want you to understand that you can trust us. You can trust me. You can trust Ms. Tony to understand that we're looking for alternatives so that people don't have stuff like they can't vote. You're on probation, so now you can't vote. So this has been in the news, right? And so how do you take away people's citizenship? Taking away people's humanity. Those are important qualities and characteristics that people must maintain to really embrace the law, embrace the criminal justice system, embrace society, embrace our norms and values that we have outlined in this society. And so it is important. It's important to treat people with dignity and respect. And Ms. Tony and the city of Winston-Salem have, envisioned this approach and envisioned this program primarily based in that concept. This idea that respect is important, this idea that the humanity of our community, the humanity of the citizen within our city of Winston-Salem, these things are preciously important to all of us, preciously important to the city council, preciously important to the city, and this is why we are engaging in this conversation. What if I told you that in 1975, there was a project on this same thing, social worker and police officers working together? What if I told you that across the state of North Carolina, there are some cities and some municipalities that do have this working relationship with police, law enforcement agencies, and social workers and mental health workers for domestic violence? So we don't have to go and reinvent the wheel. We have models out there. And what is the pushback against making sure that everyone is safe, making sure that everyone is protected? Not just a citizen, but this is also protection for our police officers. And so when we build trust in our police officers, when we build trust within law enforcement, what we're building is great attitudes towards this particular institution, and we're building trust, respect, and everything else that police officers keep saying that they want. So I'm excited about this challenge. I'm excited to hear your perspective and your views on the way forward, because we never go in, Dr. Manella and myself, never go in a community and tell people what to do. We listen, and then we can move forward from there. We do have the theoretical and methodological background, and so but your input is important. Your vision is important. Your vision is going to be what's going to lead us. Your vision is what's going to lead us to an effective program where we're saying here we're embracing our citizens, we're embracing the idea and shouting for the idea of dignity with how we deal with citizens in our community that has mental health issues, okay? I think Ms. Tony is going to give you a little background on what the project has been, what has gone on in the project so far, right? You're going to give some? Yeah, okay.
Just really quick, because I do want to hear from you all. The city's been looking at, it started actually in the budget office. They started looking at some data, and we worked with the RTI, which is a research firm, to start looking and analyzing our police data. What they were able to pull based on the 911 records and how they log police calls were so many calls that were definitely mental health related. So it could be suicide attempt, it could be involuntary commitment, it could be voluntary commitment, it could be a mental health person that's nonviolent. So there are actual codes that police officers use when they are logging their police calls. So those calls were pulled. On average, it was 3,000 per year of calls that were related. Now, a 911 operator, when they take the call, cannot always fully assess what's going on the scene. And so sometimes it's not until the officer actually arrives on the scene, and then they may realize that, okay, maybe this person just didn't take their medication or whatever. And so then, and I don't want to say what the appropriate response would be, but we know that if the person is belligerent or non-cooperative, there are other strategies in managing that. Police officers are trained on certain responses. We just know that there are alternatives to that. And what that looks like, we have seen some best practices in other cities, but Winston-Salem is unique. And so we want to create a model that makes sense for this community, and that's why we really seek your feedback. So we're really at the point now, we've got the data, we've seen what we've captured, we've seen what other cities are doing, and now we're at the point of engaging the community and just making sure we hear from you so that hopefully by next month or so, we can present a model that makes sense for the community.
So we only have one mic. So this is very organic. So this is the context in which we wanted to meet with all of you. Arguably, this meeting is for you, which I know at times is not what we're accustomed to. But the city is really wanting to ensure that your voices are heard. So we're going to be quiet. What would provide us some kind of background information when you do speak, if you can kind of like just say what area of the city you live in. For us, that's it kind of allows for us to kind of get a framework of where people are located within our area. But just we're going to begin with something as simple as, what is your understanding of what's happening as it relates to police responses to people who are decompensating in the city? Police calls, we've seen it on the news, we've seen it in the community, but we want to hear from you. What do you think are better approaches? What do you think occurs well? What do you think doesn't occur well? So that's what we're here for today. Like Dr. Nation said, we can ramble days and days about theory and application and methodology, but we do that after. So we need the information and the data. So this is your forum. So please feel free. Don't be bashful. Obviously the room is packed, so people came because they want to have their voices heard. So please feel free, flag me down, and then yes, ma'am. Okay.
Because I'm short of breath, I'm going to stand up and I want to see folks, so if that's okay. Because I have a feeling that what I've experienced is similar to what other people have experienced. But I live in the South Side neighborhood. It's brown, black, and white. And my name is Laurie Coker, and I am so thankful for this moment. I'm a longtime mental health advocate in Winston-Salem. I'm a retired psychiatric nurse. Presently, I'm a certified peer support specialist. I'm the co-founder of the Forsyth Mental Health Collaborative with Martha Martinette. We used to serve on the Commission for Mental Health together, and that's where we brainstormed about starting that. So there's a mental health collaborative, which Andy Hagler chairs now. I also participate on the Mental Health Substance Use Advisory Committee, which sadly is meeting right now. And I didn't get a notice about this until Saturday. If we'd had a couple weeks earlier, I think we might have had some rerouting done. We might have had a lot more participation from people who are impacted by the mental health system here. I'm a founding member of Peer Voice North Carolina, which is a network of folks who have mental health substance use issues in their past. I have bipolar disorder as a diagnosis, but I've learned how to live in a way that I've gotten beside it. And so with that being something I've lived and experienced, I know so many other people across the state who have recovered, and we're very concerned about this issue. And so Peer Voice North Carolina has a coalition now of people with their own lived experiences called the Peer Advocacy Coalition. And as it happens, just this morning we had a webinar where we had a legislator and a public defender from Mecklenburg County. We just had a really wonderful conversation to learn about 3 bills coming up. But so there's some bills that might help support some changes in our communities. I operate Green Tree Peer Center, which we receive a lot of folks in crisis. We're on South Broad Street. We're open from 10 till 7, and it's just a walk-in kind of thing. So we've gotten to a place where Forsyth Hospital or Navant and Baptist Hospital or Atrium, with their name changes, industrialized healthcare. Anyway, they will bring people, or they will call us, and we will pick people up from the ED, because more than half the people who go into the ED are not seen as needing inpatient care. But their crisis doesn't go away just because they've been with a clinician for 7 minutes. So we offer that kind of support where they can kind of get emotionally re-regulated, and then we can find out how we can help them, link them to the things they need. And so that has made us very aware of the crisis issues at another level, especially the level of opiate-related things. We've been able to help people get into treatment, detox, and all that. They're not going from the hospitals to detox. They're coming to us, and then they're going to detox. This is all to say we have a system that's kind of chipped up and, fractured, and so we need groups like us and resources like Andy, who knows all the resources and can help people through the phone and all that. But what qualifies me most to speak on this issue is my personal experience with many of our local peers and our own son, Peter, who took his life about 2.5 months after an encounter with law enforcement officers. And I will say, I say law enforcement officers, but I'm trying to retrain myself because I've met a lot of these people, and especially some of the younger officers are truly public safety officers. So we all want to see them less as enforcers and more as safety officials, But at that point, Peter, who had drunk too much and who was in a manic state and delusional, was accosted by some officers who were supposed to have been trained in crisis response. And the long and short of it is there was a claw mark on an officer's arm. He would be charged with assault, and he did not see how he was going to not end up in jail. He did not think he could handle being in jail in a long-term way. And so that was one of about 3 factors I think really compounded. But besides that, a lot of us have known about situations where officers rushed into a situation, and before you know it, a gun was pulled. And so I really take this crisis issue is probably one of the most driving issues of all the work I've dedicated myself to. That's why I'm so thankful that you guys are involved and that the City Council is looking at this. But I wanted to urge us to consider that when a crime is not really actual, or there's no potential of harm to self or others, I really believe we need totally non-police crisis response teams, and there are several models across the country that are all very similar, actually. But and y'all probably have heard of some of these. The CAHOOTS model, the STAR model, both of them pair a paramedic with a mental health professional. And then there's another model that may be more applicable now that Winston-Salem is no longer a suburban. We have very urban problems now. And that is called Portland Street Response, where they have a peer specialist, especially who's actually experienced homelessness and then recovery, because so many of the situations, and this is happening right now, probably 75% of the folks we end up supporting at Green Tree are people in active addiction, and most of them are homeless. And so having a kind of response that has some expertise that can respond to and engage people, make them feel safe, help them kind of calm down and enter into that process of getting help could be really important. So I'm trying to suggest that a co-responder model where you have a police officer and a mental health person is not enough, because it still tends to criminalize an already hard situation. You build trauma on trauma, and what ends up is chronic trauma. We want to see people recover their mental health. I mean, people recover, and this is something I'm working with Baptist Hospital clinicians who admit our psychiatrists don't know what mental health recovery is, because North Carolina uses a medical model that mostly looks at symptoms and developing crisis response. We need to move beyond that. We're out of date. And one way to do it is to look at how to respond to people in crisis, because how you respond to someone in crisis sets the tone for everything that happens after that. It either slams the door on their life or it opens the door to hope and possibility. So that's what we want to see happening. And just one last little comment. The thing about Winston-Salem is, like Charlotte, we have a peer-operated setting that can help support folks. We have police officers bring people to Green Tree. And we already have kind of that fabric of support underneath a rather holy safety net. And so we have some things in favor in our community that could really support an alternative. So thank you so much for this.
Thank you.
Thank you. My name is Phil Carter, and I'm very concerned about police response as it relates to coming on a scene when there's someone that's mentally ill. From my experiences and having seen many times where police were called in African-American communities, maybe even at a convenience store, and everybody around that individual knows that they have some type of cognitive deficiency. And for me, it always scares me, because I'd be afraid that if the people are not saying, hey, officer, his mind ain't good, you know what I mean? And I can see the person are in panic, you know what I mean? And I be saying to myself, I hope they don't get beat down or killed, you understand? And I see it quite often, because I see so many people walking our streets that it's evident that they have some type of mental disorder. So my concern today, in listening to Madam City Assistant City Manager, with the dispatchers, what they also receive some type of training to whereby they could better guide the police officer to whereby they could seek out someone else to be the first responder. Also, will there be a way for family members to let the police know that they have a member in their family that has a mental illness, that do walk around and go to the store, you know, things of that nature. Now, again, there's a lot of people in this room. And I must say, as being an African-American male, I'm even afraid when I see a policeman, because I know how things can flip. And I know that likewise, when, as you spoke to, that when that person is powerless and voiceless, it's easy for them to sometimes be mistaken or taken advantage of. So I would hope that if we do create an alternative program, that it would have just as much community input as it does hierarchical deployment. Community input. What do some of our organizations, and then sometimes what do residents say they're seeing and how they would like the alternative program to be handled. I want to thank you for having this meeting. I want to thank Hate Out Winston for notifying me of this meeting. Thank you.
Thank you.
Can I say one thing?
Yes. Here you go.
I just want to address what you mentioned about the dispatchers, 911 operators. Yes, the vision in this program is that 911 dispatchers will have extensive training in recognizing when this mental health counselor or social worker, so on and so forth, will be needed at this call. So that is an important piece of this puzzle that we're trying to put together. Okay.
Excuse me.
Good evening. Oh, I'm loud, y'all. I'm sorry. Miranda Jones, representing Hate Out of Winston. We have been working on this for almost 2 years now. And I want to lean into what Dr. King called the fierce urgency of now. We absolutely need the alternative model, and we need it like now. We are not anti-law enforcement. Let me be very clear. Our platform is not to attack police officers, and while we do respect scholarship and research and study and all of the intellectual fortitude that it takes to do what you do, we also do our research. And let me just say that people with mental illness, Black people, we have the bodies. Y'all have the research, but we have the bodies, right? And so we're trying to stop that, and we've been coming to City Council. We've been at the meetings over and over and over, and we provided the research that we've been able to pull up all over, from the cahoots model to, I don't know, y'all, when they talk, they'll tell you the other models because they work in mental health. I'm a teacher. And so we feel like we've kind of done enough. We are not in favor of the co-response model because for many people who are mentally ill, for many Black people, when they see the badge, they get concerned. So for instance, I'm a Black woman. I was pulled over the other day in High Point. I work at a school in High Point. I don't want people to come after me. And so people get very upset about law enforcement. I think this is my cousin who's a police officer. Oh, and so I'm not, this is my cousin. She's a law officer. So I'm not against police. And so when the officer pulled me over, my heart started pounding, okay? Because I'm a Black woman who has PTSD diagnosed, right? And so I'm like, Lord, please don't let this go wrong. And so all of my friends who are here tell you I had to post on Facebook that I was pulled over because as a Black woman with PTSD, I don't know what I'm subject to say when I'm triggered, right? Now, I'm standing here before you because thankfully it went well. The officer said I paused and I didn't stop. Now, I don't know how you stop without pausing or pause without stopping. I don't know how that works. I'll be honest, right? But I just want to say that I think we have to do something now. We've talked about cahoots. We don't want another body and then we're out in the streets and people are nervous and we have to get permits and you're saying here they go with these posters and here they go with these chants and all of these things. I'm just so grateful that all of you came out here to stand up on the side of the marginalized and the oppressed and the mentally ill. We've proved that this is a cost-saving measure, right? This is not us out here saying we're trying to tear down your police department. We're not trying to unleash anarchy on people. Because I think when people hear this, they think that we're saying we want an uncivilized society. That's not what we want because we have to live in this society. We live in this city. Oh, to answer your question, I live in Ardmore, Winston-Salem. So I don't want anarchy in Ardmore, right? But what I do want is the alternate model now. Thank you.
So real quick, I do want to very well said. Thank you, ma'am. Yeah, I get triggered too. Don't let the suit fool you. You know, I get the same treatment. But I will say this in reference to the police comment, and I think that's where the media, unfortunately, once again, as they do with a lot of things at times, they misrepresent the truth. So the one thing you will hear from Dr. Nation and I and the students we instruct and the community members we engage with, it's not, we don't subscribe to the notion of getting rid of the police. That's not the concept. But we do realize we have to reimagine how to do things. We as facilitators of information, we have to evolve, right? The students we had 20 years ago are different than today. If we're stuck in those ways, we wouldn't be as effective as we are. It's the same thing in policing, it's the same thing in teaching, it's the same thing in even leadership, city leadership, that is. So the one thing I always like to tell community members, and I've been on many a panel with Sheriff Kimbrough and Chief Thompson, we trust y'all, we respect y'all, but we have to reimagine how to do things. And as the society shifts, and as we identify these issues, which right now mental health is a big one, then we have to address that. Secondly, I thank you and we applaud you for the efforts. You're right, you do have the bodies. And when we met with Ms. Tony a few weeks ago, we told her, listen, we work with community leadership. You guys are the ones doing the work per se in this capacity. And we're here to support. That's why we're here. We're not here to pontificate and talk and tell you how great or smart we are. No, not at all. So I do thank you for that. But I did want to say that because I know at times when universities are involved, and remember, we're a university in East Winston, so we understand kind of what's going on in the community very intimately. We've lost students, sadly, in reference to mental health and all that. So this is personal to us. This is community activism. So go ahead, sir.
Thank you, sir. Good evening. My name is Scott Andrew Bowen. I also live in Ardmore. Last summer, I was doing some work over at the Liberty Street Market for a farmer's market they were having. And there was a gentleman who was obviously had some mental illness and looked to be homeless. And he was, in your stereotypical manner, pushing a shopping cart with all of his belongings in the cart. And he was having some difficulty going from what I believe is the Citgo gas station just across the street. And in the middle of the street, all of his belongings went off and just fell into the street. He started to have a little bit of a breakdown, and the police were called. And 3 police officers, 3 different police cars showed up. Now, I'm going to say congratulations. They did a fantastic job of de-escalating the situation. They helped the man pick up his belongings and had him on his way. I also support this alternative model where I think that if at that moment, if 911 acted like a triage, they could have called these people who were social workers and de-escalation people who could have then gone there and to help de-escalate and help this man to where he needed to go. We mentioned the Denver Star model. I know that they have their 911 people treat it like a triage. So they listen to what the call is, and then they make the appropriate call. And then if things didn't escalate, then the police then will come in. So I'm full of support this idea of an alternative motive. So thank you.
Thank you. Okay, I'll come back. Thank you.
Thank you. Can you hear me?
Yes.
So I'm going to say that even though I do presentations, I'm a little nervous. So I'm an interesting case. I am a retired school teacher for 20 years, assistant school teacher, so Yates is teaching, all right. And I've acted in school, acting. What a wonderful concept. So what I'm trying to say is I am profoundly IDD, autistic, and I have schizophrenia. Oh my. So I have the 3 witches that I have to deal with. So at any given time, my barrier comes off, I get tired, I don't know where I am, I don't know who I am, I can't communicate because I'm actually nonverbal. So I feel vulnerable. When I'm with my wife and I'm autistic or something like that, I would say, uh-oh, because I don't understand. So I would appreciate a rethinking of where we are. Thank you very much.
Thank you. I should have worn my running shoes now.
Good evening, everyone. I'm really nervous. I I don't have a lot of accolades. I'm just currently a MSW student at the University of Chapel Hill, University of North Carolina at Chapel Hill. I've in the past worked at behavioral health centers, and so I've been able to see firsthand that, putting your hands on people or, doing things that are physical to others does cause more stress, more trauma. It takes them longer to recover, so they're supposed to be receiving treatment for one illness, and now we're stacking things on top of it. I am in agreement for a co-response model, but I think that we need maybe plainclothes officers, plain cars, and we do need clinicians in there or people who hold MSWs, because I think it's a difference between protecting and serving and diffusing and defending. And I feel like, we're able to talk people down and we're able to get to the root of the issue, which police, yes, they do solve issues, but they're trained to solve it in a different manner. I also think that people can willingly join a registry. I know it's certain HIPAA laws and stuff, so you can't just put certain information out there, but maybe if that registry is voluntarily done, where if you have people in your household who suffer from certain illnesses and it can be accessed by those dispatchers, that maybe we can respond more appropriately in addition to the co-response. Thank you.
Humility aside, don't downplay your accolades. Good job. Don't downplay that. Come on, brother. And I'm working my way back over there, y'all.
Greetings. My name is Terry. I was misdiagnosed at kindergarten for having a mental illness. As a result, my life has been difficult. 6, 7 years, 8 years old, asked by all type of people, Terry, why do you act this way? As a child, I could not tell you. And so my answer was, I don't know. And I had an abusive father at the home, and I never acted up at home. But when I was at school, I had a lot of problems. So yeah, this is an interesting dynamic. I should be compensated because I was misdiagnosed. When it came to high school, I was supposed to not go to college. I was on the career tech path because I was a person identified not smart enough to go to a college university because I was diagnosed at 5 years old. After completing college and getting a sociology degree, I could identify the reason why I acted the way I did in school is because I was institutionalized. If you put anybody in that type of setting at that age, of course they're gonna spit and cuss and run around because that's all I seen growing up. A few years back, I was at the Black Theater Festival with my family. All of my family, we was at the Crab Shack. We was having the best time of our lives. And as the young man that I have grew to be, I seen a group of individuals acting kind of rowdy. I took it upon myself to go over and speak to the young man because I recognized one of them. I whispered in his ear, hey, y'all should cool out. It's a lot of police around here. And I turned around. I didn't get to say much more than that. I turned around and bumped into a line of about 3 to 5 officers. And one of the officers says, hey, don't put your hands on me. And my response was, put my hands on you? If anything, you're in my bubble. You're in my personal space. And I didn't get to say much more than that before my auntie put her hand on my face. And she said, Terry, calm down. And they picked me up. They slammed me to the ground. And they took me to jail. And they charged me with all type of baloney. Why? Because I'm black, because I have long hair, because I'm identified as a threat. Cool. I should be compensated. I had a vehicle that was a gift given to me by my neighbor. I was trying to get it fixed. It was parked beside my ex-girlfriend's house at the time. It was like 2 feet off the curb. The police came along, towed my vehicle. When I called the police department, I said, hey, why did y'all tow my vehicle? We're gonna look back on the cameras and see how far it was away from the curb. Regardless, like, I'm poor, I'm struggling. Y'all repossessing my stuff during COVID. I can't, like, and so I work in the community every day. And like, my thought is, whatever y'all can do to keep the police out of the community, do that. Send somebody else in with some training or understanding or compassion. I think that was pretty much it.
Terry, let me ask you.
Hold on, one more thing, two more things. Also, since I do work in the community, and I am a member of a street organization, and in a time of my life where, you know, my daddy had lost his business, and his advice to me while I was in school was, come home and find a trade or do something else. Stop wasting you and your people, those people's time. And this time in my life, the street organization encouraged me to go to college and complete my education. So I said all that to say, maybe we should get some funding or some grants for people in street organizations who operate in a positive manner, because those are the individuals who are engaging our mental health, whether we know it or not, and controlling the youth, XYZ, blase, blase. And also, let's do stipends for parents who decide to homeschool their children, because I don't necessarily believe in the school system. Man, that's all I have.
Okay, thank you. But I actually wanted to ask you, you know, you had that negative encounter with these police officers. Have you had, have you had many encounters with Winston-Salem PD?
The type of individual I was, I enjoy talking.
Well, you know, let me step so we can share the mic, okay? So that it can capture everything.
I was the type of person that I always talk to the police. I don't have no problem with the police, but if I feel like my life is in danger for no reason, then that changed my attitude or perspective of the police. So I try to stay out the way.
Okay.
Right.
So I think what I'm trying to get at is, you know, we can have these discussions with police departments about, you know, how you go in situations, how you deal with people. And again, I always talk to police officers. I don't train police officers, I mentor them. So yeah, so we have a training, but I follow up 2 weeks later, 1 month later, 1 year later, so on and so forth. Because Dr. Manel mentioned this earlier, but this idea is that police have to transform, you know, they have to transform with what's going on. 22nd policing will not look like 20th century policing because the citizens just won't allow it. And so what we've seen in this George Floyd moment is that it's gonna extend, and police managers know this, right? So with this particular program, what we envision is a group of officers that that we know and we have trained in this idea of human dignity and how you let the professional step forward, because your 2 months of training is nothing like Miss MSW, okay? And so this is our vision. This is what we want to see. We want to transform what's going on, and it should extend beyond mental health, just to something like what Terry just told us about, right? Yeah. So, so this is the vision we have, right? Because we're also concerned about everyone's safety. We are. And you can go in situation and it just goes left really fast, right? And so sometimes we have to, you know, figure out that nice balance. And that is why we're talking to you, and that is why, you know, what you have to say, you know, we just need people to just be honest about what's going on. Yeah. Who was next? Sorry.
Working our way down. Get it, ma'am. Thank you.
Okay.
All right. You mentioned respect and you mentioned dignity for all people. And I think, my name is Jillian Neal. I'll say Dr. Jillian Neal because my credential is important in this case. I'm a psychologist. I'm a licensed psychologist in the state of North Carolina. Respect is important. I completely agree. And that's why I'm standing here and I want to advocate for an alternative response model and not a co-responder model. And the reason for that is I think it demonstrates the highest level of respect and dignity for officers, for people who have mental illness, for science and research and data, because there's so much information that backs up that a co-response model is, or that an alternative response model, an alternative response model is the appropriate response in this case. People with mental illness are not categorically dangerous. A co-response model suggests that a police officer is required in a case where they are not required, right? A public safety officer, a police officer suggests that there's danger, that there's a threat. It suggests that people with mental illness are a threat, and they are not. In fact, they are much more likely to be the victims of violent crime and the victims of police shootings than people who do not have mental illness. There is good data to show us that. And I work in suicide prevention, I work in mental health promotion, and I work as a clinician as well. And I have trained police officers in suicide prevention. I have trained police officers in de-escalation. They don't learn this stuff, y'all. They don't learn it. It took me 7 years to get my doctorate, and I'm not saying that everybody has to have a doctorate to do this, because Miss MSW over there would probably be better at it than I would, because social workers are amazing, y'all. Let me just say that. I love social workers. But my point is that, police officers, if we respect them, we will let them be police officers and not make them be mental health professionals and social service professionals and all of these other things, right? We will create a social safety net that allows people to do the jobs that they are trained to do and not feel like they have to be all things to all people. There was a quote from the police chief here in Winston-Salem, and I can't remember it off the top of my head, of course, but, suggesting, we're asked to do all of these things, and we hear that over and over and over and over again. Well, we can save the police department resources, and we can save them money, and we can save them the fear and anxiety of having to deal with situations for which they are poorly trained. Just like I don't want to approach a violent criminal situation because I'm not trained to do that. That's not my thing, right? I don't want to be armed. I don't want any of that, right? So why would we expect them to do the job of a mental health professional? Why would we send them with a mental health professional when that mental health professional should be fully equipped in and of themselves to handle that situation? And just like other cities have implemented, whether it be Denver, whether it be New York City, whether it be a city that, because everybody says, oh, those are big cities, they have all these resources. Eugene, Oregon, where the Cahoots model originated, thank you, is smaller than Winston. If they can do it, we can do it. Why can't we do it? Everybody comes up with all these notions and all these ideas. Show me data that show why we can't do it, because we can and we should. We absolutely should. And I talked to city council about this, January of last year. It's been, 15 months, something like that. Come on, y'all. Let's get it together. Let's go. That's all I have to say.
And I will say this.
Thank you. And I live south of Ardmore. People in Ardmore would be mad if I called it Ardmore.
But arguably, that right here, perfect segue to our law enforcement issue. That's why we're here tonight, right? And as one who used to work in the government, sometimes things take time. And I'm not excusing nor condoning anything, but there are bureaucracies in place and procedures in place. Not just, but we're here, I'm about solutions. We're about solutions. So we're here today to receive all of this. Ms. Tony's here today, and we're taking notes. And the objective, the one thing I can say unequivocally, my colleague and I, we don't do anything halfway. So when we're asked to participate or engage on any projects or initiatives, if we don't think it passed, we don't get engaged. Right, that's what I'm trying to say. I got stuck too for a minute, right? I'm usually good with the sayings, but anyhow, please go. I'll be quiet.
So, my name is Yasmin, and this is my cousin. I look a lot like my sister. It's my sister that's the police officer, so I'm sorry, y'all. Yeah, we look a lot alike. My background actually is I spent 4.5 years in the county medical examiner's office, and I spent a year as an EMT. And during that time in the county medical examiner's office, I witnessed the age of kids take their own lives starting at the age of 8, and the age got younger and younger. This too is, and I'll try not to get emotional because that is an emotional thing to see. It's something you can never get out of your mind. But this is a answered prayer for me, because so many times when those kids would come in, they would have their suicide notes. And oftentimes they had reached out to guidance counselors who, as parents, we've been told, oh, they're trained to handle the crisis. Last week, I reached out to my daughter's school counselor, and for 11 days, I didn't even get a return phone call. When I did get the phone call, well, actually, I had to go to the school because I never got the phone call. This touches me on so many levels because my daughter has always been academically inclined. And over the last few months, things had started to falter. And I wanted to know if they had witnessed anything at school that had changed. And I put myself in the shoes of so many of the kids that I worked on in Amy's office, because if for not the grace of God, it could have been my kid. And I say that to say, even when the Mount Tabor shooting happened, Sheriff Kimbrough assured parents that staff would be, counselors would be on staff to assist with this. Well, my guidance counselor, my students' guidance counselor sat in her office last week and said, we are not trained to do this. We are only equipped to deal with the academics. It is not our job to intervene in a mental crisis. My job today is that of an advocate. That is my job title. I am so happy to hear the young lady that stood up and actually admitted that healthcare organizations are admitting they are not equipped to handle mental health, and it is true. The resources are not there. On top of that, I hear it takes a vulnerable person to come forward and say they need mental help. And the stigma that has been placed upon that is appalling, and it's disgusting. And sometimes the way these patients are treated when they come in seeking help at one of the lowest points of their life, it is awful. And you have so many of them that are fearful to come back because they've been treated so terribly, judged, and told they're crazy or they're out of their mind. That is something that has made the medical profession not as notable as it used to be. And I hear many patients say, do you know the struggle that I go through to face the world every single day, only to be told or looked at, oh, that person is crazy. I have heard so many stories of people saying that if you come from a mental health background or if you come from a drug background, oh, it's okay for you not to be all you can be. And that's why that person acts out the way they do. Well, I stand before you today as a witness to say, Both my mother and father suffered from mental health, and my father suffered from drug addiction. One of the best people you could meet, but could not overcome his addiction. But I stand here as a graduate, having earned my Bachelor of Science in Criminal Justice and General Biology, minoring in Forensic Biology, holding a master's degree in Healthcare Policy and Law from Wake Forest University. So to say that someone that comes from a mental health background or addiction can't be all they can be, that is that fails them on so many levels. It's such a disservice. So if we could train the professionals to get out of the way of being a professional all the time, or looking at it through a medical scope instead of compassionately or empathetically, or treating a patient on an individual basis versus looking at, oh, this is how we do it in the medical way. I am also for an alternative method, not for a co-response, simply because as an EMT, I've seen a co-response model done where I stood in my uniform as an EMT and I was respected by law enforcement and everyone that stood around me, while the patient that stood in front of me was disrespected, all in the same call. So, and I will say that my sister, who does serve as a police officer, when we take our uniform off, when I took my uniform off as an EMT, I also have been pulled over several times because they cannot tell the difference, that we are also colleagues standing actually arm in arm. But the fact that I'm not in my uniform, you can only see me as a black female. So if we can't get out of the way of our own selves, that's first and foremost. And so I advocate on behalf even of my daughters today, because I have one that is 5 and one that's 15 and still going through the stigma of what it means to grow up in this community, black, because we do live on the South Side and we witness these things often. Thank you.
Thank you. Yeah, my name is Farad Dunn. I pretty much just had an idea because I like to be more of a problem solver than a complainer, but something I noticed in the community is just low-income housing, not really having the availability to therapy and things of this nature that'll nip some of the things as far as identifying some of the mental health issues, along with helping people avoid some of the mental health issues and getting away from, you know, where I'm from, they usually use drugs and alcohol to as self-therapy. But I think we just need more alternatives for some of the low-income housing. Pretty much, that's it.
Excuse me. Hi, everyone. My name is Eunice Campbell, and I'm from the North Ward, and I've been listening, and my experience with mental health is very personal. I lost my sister in November from mental health, drug addiction. And seeing someone go from a fully functioning human being to someone who is mentally disabled because of drugs is disheartening, is tragic. And then with that came encounters with police, where she was treated like a criminal instead of someone who had a mental health issue. So I feel that to my heart. I feel that to my soul. And I'm listening to everyone else. I'm serving as a long-term sub right now at a school. And you're right. Police cannot do everything, just like teachers are asked to do so much. That's not what you have your degree in. That's not what you were trained in. So it's insulting to the people who have these degrees to think that someone can do a week-long training and know how to handle that. It took people years of encountering with people to be able to master and be able to perform adequately at a split decision when you have to make the split decision. When I can't handle this, when do I need to call the police? And you can't panic. So we definitely need somebody other than the police because they just don't have the time to get a degree in what they need to have a degree in. And like I said, you can't just train somebody to be this way. You can't train somebody to be beyond what their personality is as well. If I don't already have that empathetic soul or compassion, you can't train me into it. So that's not going to work. You just can't train me into it. So as far as the personnel piece, you really would have to have people who have that degree, have that experience, not necessarily fresh out of school as alone by themselves. They need experience, they need time, because these are situations where you need to have proper judgment, a good call. So you have to have that experience to be able to do that. Because to be honest, we are living in a society where people are living with undiagnosed what is called PTSD? Right. So people are already mentally going through things and never have been able to get the help that they need. So you may not know, you don't have to already be diagnosed with a mental disorder. You could be walking around functioning one day and then the next day you're not able to function. And people don't know, so you have to, like I said, you need the experience. So you just can't pile things onto other people. That's my first point. My second point is, how is the city going to pay for this? Does it come out of the police budget? Or are you going to try to get grants to cover this? Are you working with the county in any way? Or are these going to be strictly city employees? Because that's an important part. If it's not a line item in a budget somewhere, then we're just talking tonight. It has to be fully funded well, because what you're asking people to do requires a very good salary. And you want to attract very good people, so you have to pay them well, because you don't want to half do it. As my mama said, you don't want to half do it, because you want to done it right, because you're dealing with people. So the compassion has to be there. You can't train someone into it. We have to make sure that this is a line item on the budget and not just on a wish list, because I saw last week's meeting. I'm hoping this isn't part of that $1.2 billion that they were talking about on the wish list. So that's the important part, though. And that's all I needed to say.
Thank you, ma'am.
You want me to hand it to him?
Let me just say something real quick. We are winding down. I know you had your hand up, so I do want to come to you. I want to say this because she raised a very important point. Teachers are expected to do incredible things beyond the call of duty. Clinicians are expected to do beyond. But quite frankly and quite honestly, so are police officers. And I can't tell you how many times I've heard from people who are, I guess, educated, whatever that means nowadays, right? Well, they signed up for it. That's what they're trained for. No, that's not what they're trained for. And we kind of talk about this role confusion in the academic stuff. I'm not going to bore y'all with that. But the reality of it is, we forget that police officers are human. They have emotions. They experience trauma. It's easy for us to project onto them and always be angry at them for the individuals who maybe do things they shouldn't. But the reality of it is, they see things that you and I are fortunate not to see, rather. So just the compassion goes both ways. the grace goes both ways.
And I'll say this, like when we started talking to Miss Tony about this project, that's one thing I said to her. Like this, you know, these people have to be in-house because a police officer also needs this. Police officers need this, need, you know, mental health, you know, support. If you don't want to call it counseling or evaluation or whatever, I call it support, right? And that is particularly going to be important that the person or the people who are in this, you know, new transformative, and I told her I want to see something transformative, something that's changing this police department or the city, how this works, and let us be a model. Let us be a model for other parts of the country. And it shouldn't be it's not going to be a short-term thing. It's going to be part of what they do. It's going to be part of their structure, okay?
Limit your comments going forward because we're at time, but just really quick.
Oh, okay. Yes.
Yeah, I mean, thank you. I've been chilling all night, so I'll try to make it quick. I have it written down. So good evening. My name is Bink. I live in the North Ward, and I'm here tonight as a member of Hate Out of Winston, and also as a citizen that has mental illness. And I would like to request that the city opt for a true alternate response model without police ride-alongs for non-emergency mental health, substance use, houselessness, and other social needs. I have seen a great deal of fear and misunderstanding on social media since this meeting was announced. People who say we are setting up social workers to be killed or that the police are going to be needed anyway, so why not start with them? And I understand being afraid. For almost all of our lives, the police have been seen as the group of people that exist to keep us safe. This is not something we are trying to change or take away. What we are asking for is to stop sending law enforcement to handle calls where no law is being broken and no one is being threatened with harm. We've all heard tonight about STAR and Cahoots, so to tighten it up, I just want y'all to know that the STAR pilot team was 2 people. They received, this is in Denver, they received 2,700 calls and not one of them needed police backup in the first 20 months that they started. This year they are expanding because it came to light that Denver receives 11,000 calls like this a year. In Eugene, where Cahoots operates, in 2019 they took 24,000 emergency calls, and police assistance was requested for 150. That is 0.6%. 911 operators are being trained to ask the right questions and evaluate the situation to determine the best response, and it's happening successfully. My husband is a fortunate survivor of a terrible manic episode where his family called 911 because they didn't know what to do. Despite the fact that he never touched anyone, he was tackled by police and body slammed to the ground simply because he turned and walked away. Because he was not in his right mind and was unable to be compliant. He was lucky that for whatever reason, his brain said walk away and not rush toward. He was lucky he was white, but he was not lucky to be assaulted by police. He was not lucky to be taken into a hospital overnight before being released without any real treatment, instead of being cared for until he was stable. It took 4 months when it could have taken less than 2 weeks. I share these stories with you to show that alternative response models repeatedly demonstrate that people experiencing mental health crises are not dangerous, nor are they criminals, and to make it clear that this type of alternate response does not set social workers up to be in harm's way, or that police will be required no matter what. We are not asking for this because we don't care about the safety of others or because we hate police. We are asking for this because it takes a village to care for all of our citizens, and an alternative response model is the most appropriate care when people are in need. Chief Thompson's quote is that we were expected to be everything. Teachers, social workers, she asked for this help. And so we are asking for this about empathy for police, just as much empathy for the people. Right? They need to be able to do their job. This is not about disrespect or relationship. This is about years of professional training versus months. We would not want a social worker to respond to an armed robbery, ride along or primarily. So why are we suggesting police respond to a mental health crisis? I am very concerned listening tonight that it sounds like a decision for a co-response model has already been made. And so If this is a true forum for decision-making, I urge you tonight to support an alternative model, because mental illness, addiction, houselessness, neurodivergence, those are not crimes. Thank you.
I think we're 15 minutes over.
Or did you have a really quick?
Yes, I'll be quick. Hi, everybody. I'll hurry. I'm Stephanie. I'm a therapist and owner of Safe Haven Counseling. And my background started in domestic violence with Safe on 7 as a victim advocate before I then went on to counseling. I love this. Thank you so much for having us. I did not do my research about the model names, but I've learned a lot about those different models today. As a professional helper and problem solver, I feel like problems are always unique and not always simple, not always black and white, not always one-sided. They're usually multifaceted and a little complicated. I think in some 911 calls, you're going to have a purely mental health crisis being reported, just like you might have a fire reported, in which case you need, the fire man to come. Or sometimes you're just reporting an accident. Sometimes you're reporting a crime. Sometimes you're reporting 3 of those or 2 of those at the same time. So, it sounds to me like the co-responder, just assumes that it's always more than one, whereas the alternative may assume that it's just one. And we were talking about 911 responders, like over the phone. They ask these questions: do you need fire? Do you need EMT? Do you need police? And so, do you need mental health? And according to what is reported and requested, I feel like then you just, send those people, whichever are needed. And I don't know, it just seems simple to me, but it doesn't fit in either one or the other model.
That's why I talk about this unique model, this transformative model.
This hybrid, right?
From this city.
And last thing I want to say was agree with you so strongly. As a crisis interventionist before in domestic violence and working with law enforcement closely for a long time, EMT people, we get secondary trauma. We, need, or they need support, preventative or maintenance, or burnout prevention and all that stuff, because they see horrible things, they hear horrible things, they have to handle situations that are traumatic, even though it didn't directly happen to them. So I think mental health is really important in that sense too, not just in terms of training these first responders to, do psychological first aid, but also on themselves and caring for themselves. So thank you.
I agree. Yeah. Thank you. Ms. Tony, you want to wrap it?
One last quick response.
Yeah,
okay, one last.
Okay. All right.
Mine's prepared too. Okay. My name is Cindy Andrew Bowen. I live in Ardmore, Winston-Salem. As a local provider of mental health services for individuals with developmental disabilities who often struggle to follow instructions when overwhelmed, I have firsthand experience of seeing how effective de-escalation via certified mental health professionals can be. In the midst of a meltdown or mental health crisis, an authoritative approach, or even the presence of an officer in uniform, has the potential to escalate an already tense situation in which statistically the distressed individual, the disabled individual, is more likely to be injured or killed than the responder. With an alternative response model, caregivers in Winston-Salem will be able to feel more secure calling 911, knowing that they would be speaking with a trained dispatcher who can identify that a mental health provider is needed and available to help their loved one. As a mental health service provider, I would feel more comfortable recommending someone call 911 if I knew that there were mental health providers that were going to show up and not an officer. Developmental disabilities is not a crime.
Thank
We have just one last.
you. Okay, literally, one last. We're over time. Is somebody else?
Somebody pick it. Somebody.
How urgent?
Rock, paper,
Is it-
scissors.
Okay. One last, really quick.
Thank you very much for your time. I appreciate the meeting here. My name is Joseph. I live off of Indiana Avenue, and I'll just be quick. I think one of the issues here that we haven't discussed here is how are we getting to the root of how to get to the alternative model. And I think one of the biggest issues that we've seen, people saying how mental health people are completely under-equipped and under-trained for these things. One, I would have to say, is the culture that we live in. One of the hyper-patriotic, toxic patriotism that we see, and a lot of this negative image towards the African-American community, towards gangster rap and things like that, which I do believe does have an issue. I would have to say, listen to Dr. Thomas Sowell about this, how we can look at each other without trying to have this bias. Now, everybody in here in this room, including me, does have a bias towards something, and that's something that human beings have to try to overcome by themselves here. And I think another thing here is that we're having an issue with is just the technology. When you see a modern-day police car here in Winston-Salem, you see one cop and you see a big stream of computers and things like that. That's the only other information that they have. They have no other person, no other sort of information to try to tell them, educate them, and how to do it. And I believe how do we get to this point is we look at other countries. New Zealand be one, our socialist democratic allies in the Nordic countries, Sweden, Switzerland. Those people definitely be a good way to look at. They have a whole completely view of how law enforcement and imprisonment is done. They look here at us as Americans as completely backwards of how we do everything. And I think another thing to at least start and get an idea of how we can make this model is also look at a man named Dr. Claire Graves, his spiral dynamics integral model. I believe would be a great way to start as well there. Thank you.
Great comments. Thank you. Thank you, everyone, so much for your comments. We definitely heard you. I acknowledge that, yes, the city's been, I think, looking at this for a while. It literally just got on my plate to make something happen. So this is what we're doing and trying to list the appropriate people to help us create something that makes sense. But hearing from you all, this is something we will definitely take into consideration. We heard a lot of great ideas. And we hear you. And so mental health and decriminalizing mental health is a priority, is something that shouldn't happen. The model we create, as Dr. Nation has said, maybe can be innovative. I've seen stories in other cities where 911 is the only option to call. You know, the mother who called on her first son that was having a mental health episode, all she knew to call was 911. There could be another option. You know, so, I mean, we have to think outside of even, is 911 the best option? We have a 311 for the city that is a phone number for other type of services. Could there be a public mental health line? And so sometimes people don't know who to call. Our officers right now, if you call 911, it's an emergency, it's police, fire, or medical emergency. Mental health, it could be a mental health emergency, but 911 may not be the best option. And so I liked what you said. You know, yeah, there was the list when you call 911, but maybe there's another option. Also, Ms. Campbell mentioned we have to put our money where the mouth is. That's not what she said, but at the end of the day, we do all this talking. We don't want this to be lip service. We have to put resources behind any type type of model that we create. We are in the middle of a budget process, and so this is why this is urgent for us to get something out and in front of council so that they can actually allocate some resources. Yes, there was $1 billion wish list around capital, but at the end of the day, we've been talking about this. This is important. I do agree in many ways it can save resources, it can save lives, and I think this would be something really great for our community. Miss MSW, thank you. You had some great ideas. Don't minimize who you are and the feedback that you can provide to us. We really appreciate that. Hate Out of Winston, thank you all for keeping us on post and giving the right input to this particular project. We hear you, we respect it, we respect you, Ms. Jones, and all the people who've come here tonight. So we thank you. So y'all have any last words?
Just like if, as the project goes on, we reach out, we would like to have, folks involved, focus groups, so on and so forth. So when you see the call, just, hit us up. Dr. Monell?
Everything Dr. Nation said.
All right.
Thank you. Thank you. And we'll be in touch and keep watching our public safety committees and how we move forward on this issue.